The last loops we have to see, we have to continue here a little bit, are of course the 3D loops. 3D strain, 3D mass would be worth also trying, but with this image quality it might be harder. Here we have the 4-chamber view where we have the contrast, and we also can measure here the volumes, which is not that easy because we have to see here is the mitral valve probably, and we can measure the volumes over here. So I'm doing it now rather fast for demonstration purposes, and here we have the diastolic, and here we can measure the systolic situation. And here when we take the systolic situation, we also have to focus where is the mitral valve, not overestimate, not underestimate. So it's actually hard to measure, but with the contrast it is definitely easier. So I would definitely recommend to use contrast. Here we have problems with the measurement, so it's not that easy, but overall we do see it's a small left ventricular cavity. It's a very high normal left ventricular ejection fraction, which we actually want in this patient not to be below 50 because of his medication he's receiving. The 2-chamber view, there are no relevant problematics by means of wall motion abnormalities. Here we see the 3D contrast where we have the septum, where we also see a little bit more contrast. It's similar to the late gadolinium enhancement, I would even say. And here from the subcostal approach, no pericardial effusion. And here's the IVC. The IVC is rather small and it collapses, so even a little bit pointing towards hypovolemia. And here we have the SVC. And all of this summarizes a very specialized exam for a patient with, I have to say now, actually formerly hypertrophic obstructive cardiomyopathy, because we do not have a relevant gradient now. So the patient was or received for about now 3 months mavacamten, so myosin reduction therapy, and it actually works. Strain, we started with -10%, it's improving now, it's -12-13%, and also there is no gradient present and the patient is feeling way better. With all of this, we can now go out, and with all of this knowledge we can continue to follow up our patient with a rather new therapy.